At the workshop, we discussed the employee health insurance, and that's what I'm here again tonight for, to speak to you about that, and where the board wants to go with that as far as contribution rates go for the employees. My understanding of what I was asked at the last meeting was to come up with the cost savings to the county for the dependent coverage. I was given a directive of comparing a 50% contribution rate by the board and a 25% contribution rate by the board. I was also asked to find out if Blue Cross and Blue Shield would extend our plan to January and whether or not we could change our open enrollment year to January. I have found out all of those things. Blue Cross will not let us extend from October to January. Right now we do have to renew in October. We can't just keep our rates until January. They won't let us do that. What they will let us do is carry on to October. We'll go ahead and renew in October. And in January, if we want to renew again, we can, and that will give us a new plan year starting January, which will help us a lot during the budgeting process. It won't be such a crunch for us like we've had for years and years and years. So what the board has to realize in that is every quarter, Blue Cross and Blue Shield has an increase of some sort because of claim history. When we get our new rates, if we do wish to renew again in January, the rates will have added in a quarter's worth of claims. Those claims could be good, they could be bad. We have no way of knowing that. So the board would have to be prepared to know that in January, if we want to renew again, we may see an increase. At that time, you can say, forget it, we'll just stay on an October year, and we'll see, see where we're at. We can look at it in January again, if you want to do that. Does that make sense so far? Okay. As far as the savings goes, I worked with Tracy at the Sheriff's Department about this because the Sheriff has a different Blue Cross and Blue Shield plan than us, and I worked with Ms. Diane to come up with the numbers. But I do have some figures for you to look at for the savings. I don't know how in-depth you want me to go with this. I want to keep this as simple as possible, but I also want to give you enough information to make, a good decision. And our recommendation was for the board, because obviously we want to continue on with the plans that we like the new plans. We do want to move to the new compliant plans. That's the page that I gave you with the 4 colors on it. These are the new compliant plans, and they show you landscape oriented. They show you a basic breakdown of the major services that people are concerned about so that you can see what you are purchasing for your employees. The things that really matter, your max out-of-pocket, how much it's going to cost you from day one until, if you go in the hospital, what it will cost you the most out-of-pocket, your family physician, your specialist, hospital administration fee, ER, and the provider service at the hospital, as well as your pharmacy. We like these plans because currently the plans we have a deductible for your prescription. So every January, we all are responsible for $50. None of us like it. So they worked for us this year and finally got us a plan with no deductible, and actually the generic went down to $10 instead of $15. So we're at $10, $30, $50 on that with no deductible, which will be nice come January when people have to renew prescriptions. So our recommendation was to go to the new compliant plans. We like having 3 options. We don't want 4. It's just too complicated. We do have quotes for 4. They have 4 different deductibles, 4 different, all different, obviously 4 different prices, but we like having 3. Our recommendation, as bad as we hate to do it, was to go to a 50% contribution for the employee dependent coverage, so that we could save a little bit of money and hopefully help, still help out. And if need be, next year we scale back again. We did talk about that as well, because we know what's coming.
Well, I'm sorry. If you went 50%, how much would that be for the employee with affect the drug department?
If you went 50% on
The family coverage.
roughly about $600 a month per family.
$7,200 a year.
know there's a lot of what the road department really can't afford. I kinda hate to, it's kinda like fishing. We cut it down to 50%. We take a fishing pole out here, you know, and say, hey, you can get it if you want it. A lot of people can't afford it. Even if we knock it down to 25%, I really don't know how many people can afford that.
It's even more.
That's what I'm saying. And that is, I hate to see it. And, I just hate to give somebody some insurance when they can't afford to get it.
Ms. Finch, if they could also choose Plan D, which would be a lesser of a cost to the employee. That's if you bought a high-quality insurance.
Right.
You could, the employee could still buy in a lesser of an insurance, have a higher deductible, and it would be much more affordable. Is that
That's
correct?
correct. The pinkish color, column D over there, is the lowest possible plan. It's $461 a month. That's the premium for employee only. It has a $5,000 deductible though, a $7,500 max out of pocket. So if they go to the hospital and they have surgery, a baby, whatever, it's going to be $7,500 for covered services. There aren't many services that aren't covered. Elective stuff wouldn't be. Helicopter rides, not covered. Those are things that we encourage employees and our employee and the insurance needs to be cautious with. Make sure that they're picking the covered service and network provider. But so, that's going to be a big gamble there for the employee to take, because most likely an employee, I've used this example with a couple of you, I think, and just in conversations individually, that an employee who cannot afford the plan most likely does not have a $7,500 credit card. They're not going to have the credit if they need to go to the hospital. So we're going to have a lot of unhealthy folks not going to the doctor, not, getting their needs met. I would not, me personally, I would never get that plan. But if it's all I had, if it's all you could give me, I'd get it, and I would work on ways to buy up. I would try to buy up with a lower deductible plan.
That also includes prescription also.
Same exact coverage, 10, 30, 50, no deductible. Your prescriptions are covered.
Do you know, out of our employees that's got coverage now, how many of them had that expensive of a?
How many of them have the buy-up plan?
How many of them would use up this insurance as far as the Plan D here?
I have no idea. I don't know.
Chairman, I can address it for one of my employees. 2 helicopter rides for her son, 5-year-old son, bad asthma. That's $16,000. 2 helicopter rides. I mean, they didn't have a choice.
I want to make sure I'm understanding. Right now, the county is paying 71% of the family coverage. Not talking about the employee, but the family coverage.
Correct. They're paying 71 to 72% of dependent care plans.
The insurance committee is recommending to this board that we reduce it from 71, 72% down to 50.
That is correct. If we cannot stay where we're at financially, obviously we would prefer to stay where we're at. We don't want to see anybody's pocket hurt. But knowing where we're at, budget-wise, and what we've all been told, our recommendation was to go to 50%.
Mr. Chairman, that would give the county a savings of $47,000, wouldn't it?
That's for the sheriff. For the sheriff, it's $47,000 for the sheriff, and for the board, it's $94,000, and it's $95,000.
$94,000.
That helps us with that $1.2 million shortfall.
Mr. Chairman, but understand too, it costs the county more per person than it does the sheriff's department. And that's the reason why years ago we split to save the county money overall.
But all them young folks work in the sheriff's department.
And I might not be able to keep them. If this passes, I might not be able to keep them.
Well, this $1.2 million shortfall.
And we working diligently.
Yes, sir.
Ms. Finch,
Yes.
since we've got the employee contributions on Plan B, how about getting us from A, B, and C there? Okay. You got this?
Say that again, I'm sorry.
What?
Say that again, what was your question?
You gave us, employee contribution to the plan B is $469 a month. How about giving us those for A, B, and C?
Down on the very bottom, I'm sorry, yeah, down on the very bottom, all the way across, where it says rates, over on the far left. This is the amount, the premium, that's the premium, that's not the contribution, that's what Blue Cross bills us.
That's if nothing changes. Or if this is reduced down to 50.
Yeah, these are the new rates, the new plan.